In this month's DVD section on research, I came across this article in the paper recently which says that antibiotics are linked to childhood asthma. It says babies given antibiotics appear to have a much higher risk of developing childhood asthma, warn scientists. Infants aged under 1 treated with an antibiotic were twice as likely as untreated children to end up with the condition, according to research. And infants given a multiple course of antibiotics were at even greater risk. The study ties in with previous research suggesting that babies giving antibiotics during the first 6 months are more likely to develop allergies. The findings come amid increasing concern at the rising level of medical problems linked to allergic reactions. 1 in 5 British children currently suffer from asthma, while many thousands more have wheezing problems and allergies, as well as skin rashes caused by eczema. For the latest research, scientists at the University of British Columbia in Canada analysed 8 studies comparing babies who were given antibiotics and those who were not. All the babies given drugs had been exposed to at least 1 antibiotic in their first year of life. Researchers concluded that infants exposed to at least 1 antibiotic were twice as likely as unexposed infants to develop asthma during childhood. They also concluded that for each additional course of antibiotics taken during the first year of life, the overall chance of developing asthma increased by 16%. And children on antibiotics whose mother suffered from allergies had double the risk. Now, it's a fascinating bit of reading that it makes, but it's interesting how they connect the antibiotics to probably causing the asthma. There's no mention that eating a certain diet could cause a lot of excess mucus, for example, which excess mucus sliding down the back of the throat or in the ear canal, for example, could encourage bacteria to multiply, and the increased levels of bacteria would show up when a child had inflammation, because lots of mucus produces inflammation, and inflammation produces pain, and then they go to the doctor and he takes swabs and he says, oh, there's a whole lot of bacteria, as if the bacteria caused it. You know, bacteria causing illness is a bit like saying flies cause rubbish. You know, if you have a pile of refuse or garbage, it's not caused by the flies come there because there's food for them. And it's a bit like that with bacteria. We're saying that it causes disease, but really bacteria multiply when there's food for them. So, I'm going to take a look at a couple of the websites, see what they show. What I find is that very few of the websites, very little of the research mentions food at all. I think that what the case is, children are not eating correctly when they're little, because one of the things that shows up is that even if they're breastfed, they can still be put on antibiotics. It's very common for a mother to be breastfed and eating certain foods like dairy foods like milk and cheese and yogurt, which she's encouraged to do as supposed health foods. There's this misconception that drinking milk makes milk, and if that was the case, then cows that drank milk from other cows would make the most milk. I've never yet seen a cow drink milk from another cow except a calf. A milk-producing cow would never drink milk from another cow. And yet us as humans think that the more milk we drink from a cow, the more human milk we'll produce. But in fact what it is, the more dark green leafy vegetables and fresh fruit and other vegetables that we eat, the better quality our milk would be. Now, getting back to the issue of asthma and diet, I will get back to the issue of asthma and diet. Let's take a look at what some of the websites actually say. Here are a couple of really fascinating ones. One saying Science Daily, study shows link between antibiotics and allergies. And that is a website is www.sciencedaily.com. And I just went onto Google, typed in antibiotics and asthma, and came up with a whole bunch of these sites. And these are some of the better ones, some interesting things that they've got on them. And why I particularly like the Science Daily site is that they do include some research, and they make reference to other books that can benefit you as far as your diet goes. So they're not just kind of, a lot of these websites, you go onto them and all they're doing is promoting the latest asthma drug or the latest drug relating to what you're looking at. And this one says, the source is from the Henry Ford Health System. The study shows a link between antibiotics and allergies and asthma. Children who receive antibiotics within the first 6 months of birth increase the risk of developing, by age 7, allergies to pets, ragweed grass and dust mites, and asthma, according to a study conducted at the Henry Ford Hospital in Detroit. However, They are less susceptible to these effects if they will live with at least 2 pets, namely dogs or cats, in the first year. That's an interesting one. So if a child has animals in their house in that first year that they're born, they're less likely to get asthma. But I think it has more to do with the rest of the diet, frankly. Researchers also say breastfeeding and a mother's histories of allergies add to the risks of allergy for a child taking antibiotic. The study findings are believed to be the first of its kind in the United States that found a link between antibiotics and allergies and asthma in children. And then it goes through the whole thing. You can take a look at their site. But what I do find is that they've got a very nice section on the right-hand side which says related science news, encyclopedia articles, related book reviews, and then they actually mention the China study, the most comprehensive study of nutrition ever conducted, and the startling implications for diet, weight loss, and long-term health. And it's one of the few sites that actually, shows you some other references and sites and things. And of course, the China study shows clearly that one of the foods that can impact on asthma is dairy products, and it's a huge factor. Children that are fed dairy products, fed cow's milk, for example, are more likely to develop asthma than children that are breastfed. Children that are breastfed by a mother who doesn't consume dairy products herself are less likely to get asthma than a mother who consumes dairy products and feeds her child. But there's so many other factors, and we'll take a look at them in a little while. So that's one good site, thesciencedaily.com. Another excellent site that I really enjoyed was Drugging of Our Children, Antibiotics and Asthma. And let's just get that one up. This is an article that's put together by a chiropractor, and I find chiropractors in America particularly very health conscious, not so much in South Africa. It seems that the chiropractic training in the United States seems to encourage a foundation of solid nutrition and good health. And here she says more than 5 million cases of otitis media are diagnosed every year in the United States, commonly treated health problem. This inflammation of the middle ear is often treated with antibiotics. Dr. J. Owen Hindley from the University of Virginia reviewed 100 studies and discovered that antibiotics help only 1 of 8 children with ear infections. The New England Journal of Medicine published a study regarding the use of antibiotics versus the use of a placebo. It revealed that during a 1-week period, 94% of the recipients using the antibiotics for ear infections resolved, while 84% of the placebo-controlled recipients resolved during the same period. In other words, 94% of the children taking antibiotics recovered from the ear infections, and those taking a placebo, which was just a sugar-coated tablet basically, 84% of them had success and found that they got better. So, it indicates that there's a very small percentage that seem to have benefited supposedly from the antibiotics. She goes through a whole lot of other studies. The chiropractor in this particular article is called Claudia Anreg, and the website is www.chiro, as in chiropractor, CHIRO, web.com. Very nice, very interesting stuff as well, very much health-based, and does talk about common drugs for the treatment of asthma. And it talks about the side effects of using a bronchodilator. Side effects include dizziness, a flushed face, headache, increased heart rate and nervousness. Contraindications include allergy to the medicine or a child with heart or blood vessel disease. Leukorrhine modifiers, known as variety of names, Singulair or Accolate are some of them. Side effects include headaches, nasal congestion, nausea, diarrhea, abdominal pain, weakness, dizziness, muscle aches, and fever. Now, if your child is using any form of medication, I am not suggesting at any point that you stop the medication. I'm merely suggesting that you read the insert of the pack and find out what the possible side effects are and if the medication could possibly be contributing to it. Because what you've got to do is increase the healthy, improve the diet considerably, and we'll talk about that in a couple of minutes. And at the same time, work very closely with your doctor to try and wean your child off or use a weaker form of it so that they become less dependent on it. Inhaled steroids such as Aero, Abid, and Flovent, for example, can cause oral yeast infections and may be risky in cases of serious infections such as pneumonia. And when I talk asthma, I'm mentioning children, but really there are many adults out there that have the same problem. So oral steroids such as prednisone, etc., may suppress the immune system and cause fluid retention, insomnia, and increased appetite. Contraindications are the same as those of inhaled steroids, which are yeast infections, pneumonia, etc. Theophylline, also known as Erelate and Brucodil, etc. Side effects include nervousness, headache, irritability, increased heart rate, nausea, diarrhea. Possible long-term may be the link to learning disabilities. So, there are a lot of children running around the school playgrounds with inhalers, and nobody's bothering to change their diet, improve their health, so that they're not dependent on this medication. It doesn't suit a large pharmaceutical industry to help children get healthier and follow a healthy diet. Just keep them on the medication, and because it seems so less complicated and less effort, people are looking for the easy way out, and they'd rather reach for an inhaler than reach for an apple or a banana or their flax oil, for example, and we'll talk about that in a couple of seconds. So there's some nice references on that site, and then we can go back, and one more site that I really enjoyed, it had some really nice things, was antibiotics in relationship to asthma and allergies. And this website is a Canadian doctor who studied Chinese medicine, a very young chap called Robert Helmer, spelled Helmer, and that is a Canadian website, so it's .ca, www.roberthelmer.ca. And he is the only website that actually mentions, that I've come across, that mentions food specifically, and actually talks about diet and asthma and which foods, and also talks about the antibiotics in relationship to asthma and allergies. A lot of interesting reading going on there. Talking about diet and asthma, he looks at different articles, he looks at breastfeeding, he looks at, in fact, the research that he shows that breast milk is the best food for babies and supports the development of healthy immune system. Breast milk is an amazing complex fluid, and modern medicine is just beginning to learn more about this natural baby food's properties. One fact about breastfeeding is it can lower the risk of developing asthma. We also know children have an increased risk of developing asthma, eczema, and allergies if their parents also have these conditions. Mothers who have these conditions can reduce the risk of their child developing asthma if they breastfeed for at least 4 to 6 months. I would say breastfeed if you can for at least the first year. That is essential. So those are some of the websites that we can take a look at. And I suggest you spend some time reading some of them, following them up. But let's take a look at asthma and diet. And I think this is probably the best place to actually start. It's an area that's neglected because it requires a little bit more effort, in fact a whole lot more effort. And most people don't like effort, unfortunately. The beauty of changing the diet is that there are no negative side effects, there are only positive benefits. There are no side effects like there is with medication. One of the things that didn't come up is stunted growth. Very often when you're using cortisone-based medication, is that the child's teeth are affected, the bone, the skeleton is developed, they're more likely to develop osteoporosis, for example. Stunted growth is one of them. Asthma results, let's take a look at it. When triggers causing swelling of the tissues in the air passages of the lung make it difficult to breathe. Typical symptoms of asthma include wheezing, shortness of breath, and coughing. Some foods that can provoke asthma or substances by causing an allergic reaction. Let's take a look at them, okay? Most common I have at the top of my list are the foods containing either two well-known additives, the benzoates and the sulfates or sulfites. Benzoates are things like sodium benzoate, which is found in every single margarine on the shelf, including the ones with the green additives, with the green leafy vegetables, with the olive oil extract. It doesn't matter what they're adding to it. Margarine contains sodium benzoate, and sodium benzoate, one of its known side effects is asthma. So if your child is using margarine, get them off. Butter is better, but olive oil is best. Obviously, if you're wanting to put a bit of butter onto a rice cake or a slice of bread, and you may need to remove the bread because it may contribute to it as well, but let's say it's a slice of homemade whole wheat bread, butter would be better because it doesn't contain the protein that is in cow's milk that causes the problem with asthma. There are 25 different protein fractions in cow's milk that could contribute to lung problems such as asthma. Those proteins are not in butter, it's just pure fat. What I like to do is to blend the butter with a combination of flax oil and olive oil until you've got a nice spreadable spread that can stay in the fridge but spread nice and smoothly. The flax contains essential fatty acids, particularly omega-3, which has a very anti-inflammatory effect on the body. And with asthma, what you've got is this problem with inflammation in the lungs, basically. So what omega-3 does is omega-3 is the essential fatty acid that's in very large quantities in flax oil, for example, also in dark green leafy vegetables. It helps to calm inflammatory conditions, particularly in the lung area, well, in any area of the body, but also in the lungs, okay? So benzoate, sodium benzoate found in all margarines. It's the E numbers E210 to E219, 219. If you're uncertain of this, take a look at my book, Healthy Kids. I list the actual numbers of the preservatives there, and you can actually look at them. You can go online and look at benzoates and see what the E numbers are, because very often they don't mention the name, they just give you the E number on a particular food. And then the sulfites, are the sulfur dioxide, is very, very common, E220. The numbers there are E220 to E228. E220 is sulfur dioxide. It's found in most dried fruit, it's found in wine, it's found in beer, it's found in salad dressings, it's the most common, cheapest preservative you can find, and it causes literally any asthmatic within seconds can develop asthma. It is a very dangerous additive because asthma, we know, can kill. It's found in meat products. Sulfites are found in processed meats such as cold cuts, Italian meats like salami, polony. Americans would call that bologna. It's found in, also synthetic antioxidants are found in processed and heated fast fried foods such as chips or crisps or fries. In baked goods, gelatine desserts, lemon juices, margarine, chewing gum, breakfast cereals. You've got to read the package, read the ingredients. And if you don't understand what the ingredients are, don't eat it. Don't give it to your child. Don't give it to your dog. Give it to the rats and mice if you're trying to get rid of them. Except they soon get addicted to that stuff. Just like humans do, okay? Right, foods containing yeast or mold, such as bread and blue cheeses, can trigger it. So that's why I said you may find your child has a problem with bread. They may be fine with flatbreads like matzos, for example, or what are the other, sort of a pancake type of thing that you can mix and make in a non-stick pan yourself without frying. But the things with mold, like blue cheeses, sometimes just ordinary cheeses. You see, cheese has mold in it from bacteria. And it also has, well, mold and bacteria in it, and it also has in it those protein fractions, those 25 protein fractions found in cow's milk, which can contribute to inflammatory conditions of the lungs. Foods and drinks and snacks containing the colorants E102, E104, and E110. And then, of course, cow's milk. Cereals containing wheat or gluten. Gluten is the protein found in wheat, rye and oats mainly. Those are the main grains. It's not found if those are sprouted. So, example, if you drink wheatgrass juice, there's none in it. It could be, you may find that your child has a problem with eggs, fish, soy, and certain nuts, but particularly peanuts more than things like almonds and cashews. So you need to check which foods could possibly be affecting them. But more than likely, it's the additives, the colorants, and the flavorants in foods. All right. Some foods that can control the inflammation of the airways because of their anti-inflammatory components, I've already mentioned them. They include flax oil and dark green leafy vegetables. It's one of the reasons why I'm so pro a product called Barley Life, because it's the dried juice of the barley leaf, and it's a very convenient, easy way to get it. And out of all your dark green leafy vegetables, the barley leaf is the most nutritious. You can check them all out, whether it's broccoli and spinach and kale and wheatgrass juice. The barley juice is the most nutritious out of all of them. And then we know that vitamin C, not in supplement form, vitamin C in fresh fruits and vegetables is very beneficial to somebody who suffers from any inflammatory condition, but particularly with asthma. It's a powerful antioxidant, and it's needed by the body to actually help the immune system function more efficiently. And we know that immune function and asthma are linked. Not in every single detail, but we know that it's a very clear link between a lowered immune function and asthma. Things that are high, foods that are very high in natural vitamin C are oranges. If you ate just one orange a day, you get more than your recommended daily allowance for vitamin C. There is absolutely no need to take vitamin C in supplement form. In fact, in supplement form, It's considered the safest supplement to take, and side effects of taking vitamin C are gout, arthritis, kidney stones, osteoporosis, and stomach ulcers and anemia. Now, we know gout and arthritis are inflammatory conditions, so it appears that in supplement form it actually contributes to inflammation, whereas in food it actually, because it helps the immune system function more efficiently, it actually calms the body. We need to be eating plenty of foods rich in B vitamins. Those are your dark green leafy vegetables again. And again, there you could, if you find your children or you not keen on dark green leafy vegetables, or you're not getting them every day, you can take barley life either in a capsule form. They've just taken the dried juice powder and put it in a capsule, or you can drink it. Put the powder in water, reconstitute it. Lots of fresh fruits and vegetables and preservative-free dried fruit. If the dried fruit does not say preservative-free, don't buy it. There's a lot around saying, in fact, even if it says preservative-free, because I've seen some saying preservative-free, and they've got bright orange apricots and peaches in the packet. And when I queried the manufacturer, they said, oh, there was a mistake at the printers and they couldn't throw away the labels, so they used them. So there doesn't seem to even be any integrity amongst companies with labeling. They'll put preservative-free on it, but you've got to check. Dried fruit with no preservatives, particularly the brightly coloured ones, and like things like apples, which naturally go dark very easily. If the apples are soft and spongy and white, there's a preservative on it if they've been dried. If they're dark and shriveled and dry, the apricots or the peaches, then there's likely to be no preservative on it. Right, and then we have foods that are very high in magnesium, are very beneficial to the functioning of the lungs and the immune system. Those are things like raw nuts and seeds, cashew nuts, almonds, Brazil nuts, pecan nuts are better, not peanuts. Dark green leafy vegetables, again, are very high in magnesium, and again, there you can substitute barley life. Fresh fruits and vegetables, preservative-free dried fruit, I've mentioned that. Foods high in essential fatty acids. 1 tablespoon of cold-pressed organic flax oil daily with barley life, which is an excellent source of omega-3 as well. But the nutrients that are in the barley life leaf actually help the body convert the omega-3 in the flax to the different derivatives. There are 5 different derivatives the body needs. And it helps that conversion process to make, your body then can make EPA and DHA, which are derivatives of omega-3, more efficiently. When I say derivatives, it's a bit like grandchildren and great-grandchildren of the omega-3. Right, so foods high in fatty acids. If you want to know what makes of flax oil are good, I use the Millbrook flax oil. I also use the Millbrook Superior Blend, which contains a variety of oils, including coconut oil and flax oil. I like them both, and I alternate. There's the Omega from the AIM company, the same people that make Barley Life. In the United States, you may want to use something like Barleans. In the UK, the only one that I would recommend there is the Omega. It's the only one that I know that's available at this point. All right, potential triggers. What are some of these? Common ones that I said earlier on are cow's milk and the byproducts like yogurt and cheese, wheat and other cereals. We've already mentioned those, things with molds. Their stress may be a factor, but when people are getting enough of the essential fats in their diet, we find that stress doesn't have that effect on people like it used to. If you find that you're still pretty easily stressed, and even children, you find that you can use a product called Composure, which the AIM company makes. Composure is a combination of herbs and plant extracts and has no side effects, and it's great for adults and children alike. With any inflammatory condition, it just comes in a little capsule like this. And you can take 1 to 3. I've known people that have been terribly distraught to take 7. And all there is that they're very calm, but their very mind is very clear. It's a vegetarian capsule called Composure and contains things like, wonderful sounding things like marshmallow extract, alfalfa powder, oat straw powder, passion flower, Irish moss, shaved grass, slippery elm, and yucca, or yucca, as some people would say. That is very handy when people have asthma, that it does calm them down and they find that they can handle it, and it's very safe. Children can use it. Pregnant women I've known to use it, elderly people. And that is from the AIM company, which you can order wholesale directly from them if you'd like to. If you need to know more about that, just get hold of one of our natural health consultants on our website and they can tell you where to get hold of that. Or look on our website, which you all know by now should be www.maryanns.com. to sum up, basically, what do you need to be doing? How do you avoid giving your children antibiotics? You avoid it by letting them follow a healthy diet. So often parents tell me that it is too difficult to get their children to follow a healthy diet. I always maintain, who is the boss in your house? There's no way that a 4-year-old can tell you what they want to eat. If it's not in your house, you can't have to feed it to them. And a child may be rebellious and tell you they're not going to eat. Longest they will last, ever. And we've tried this on numerous occasions with many children and seen many parents go through this. It's very scary. The longest they'll go without eating is 3 days. Most children won't go further than 3 meals. And in fact, most of them kind of get past skipping one meal and they can't bear it anymore. And a child who skips a meal is not a big deal if it means that they're going to be eating healthy food. You need to keep offering them healthy food, saying, the food that you want, the fast food, the junk food, is not available in this house anymore, but what's available is anytime you're hungry, here is some fresh fruit. Go and help yourself. Here's some preservative-free dried fruit. Here's some bars. You may want to try some of our halva bars. Our carob bars don't contain dairy products, for example, and they're sweetened with fructose instead of sucrose, which most people find doesn't have an effect on the blood sugar, so it doesn't upset the immune system as much as sucrose does. And then you need to read the ingredients of the labels on food packaging. As I said, if you don't know what it means, don't buy it. If it's not natural ingredients, there should only be natural ingredients, okay? And then work with your physician or your caregiver or a natural health consultant, whoever you're working with, to make sure that you're improving your diet considerably as your doctor slowly weans you off the medication. And in time you'll find that you can be free of your asthma. Many people have found that they're free of their asthma. And if you're trying to avoid, as I said, antibiotics with children, a healthy diet's the quickest way to do that. And remember that you're the boss in your house.